Hello, this is Dr. T. Biju Singh, and I'm going to talk about fibroids, or fibroids. Some people call them fibroids. So, what exactly are fibroids? Tumors, as they're commonly known by the common man. If you look at the uterus has, the womb as we call it. The uterus has three layers, three important layers. The outer covering is like what we call the serosa. The inner layer is the muscular layer, and then the innermost layer is the endometrium. Now, the muscular layer is the area where these fibroids grow. So these fibroids are actually muscular growths. They are growths of the muscle layer of the uterus, and they grow to form little knotty structures, which we call tumors. So fibroids can be placed on the outer layer too, what we call subserosal, and then we have intramural, which are in the muscle, and then we have submucosal fibroids. Usually these fibroids are harmless, but they can cause certain symptoms, and surprisingly, fibroids are really, really common, and they're commonly seen in the reproductive age group, and quite a few of them are quiet, but sometimes fibroids can be disturbing, and that's when it draws our medical attention. So fibroids can cause primarily a lot of bleeding in women, and that's very distressing because the hemoglobin comes down. Fibroids rarely, but not uncommonly, affect fertility because they could be growing near the tubes, or they could alter the shape of the uterus, alter the shape of the endometrial cavity, could prevent pregnancies because it's, the tumor might grow in the cervix too. So 3% of, fibroids could actually affect fertility. The fibroids, could grow forward towards the bladder and cause symptoms, affecting the bladder, like excessive micturition. The uterus, again, is placed between the bladder and the rectum behind. So, if the fibroid will grow behind, posteriorly, could put pressure on the rectum and cause pressure symptoms. We also know that fibroids could interfere in intimacy between a man and woman and could cause pain. So these fibroids, generally, we don't do much with them unless we find that these fibroids are causing symptoms and causing discomfort to the individual. So when do we treat these fibroids? Well, we treat these fibroids when such symptoms occur. Excessive bleeding, hemoglobin falling down, bladder being affected, rectum being affected, or fertility being the issue. There is a very remote and rare chance of the fibroid turning malignant, meaning cancerous, 1 in 1,000. So that's pretty remote, but a lot of people get scared and say, oh my goodness, this is going to become a cancer, and this is a tumor, and it's so large, and people land up with hysterectomy, removal of the uterus. Now, I personally feel that, fibroids, can be tackled by non-surgical methods or minimal surgical methods, and we don't really necessarily have to remove the uterus for the fibroid. So hysterectomy probably is going to become something which is past tense, because now we have many diagnostic tools and therapeutic methods where we don't really have to chop off the entire uterus just to treat a fibroid. Like I said, cancer is very, very rare. And I keep saying that because people are really scared that this might turn into something bad, and therefore aggressive treatment is employed in many, many cases. So fibroids can be treated by medication mainly to control the symptoms like the pain associated or the excessive bleeding, controlling the bleeding, or because of the hemoglobin fall, we give hematinics. So that's one way. Or you could use, again, tablets or certain medicines which would help in shrinking the tumor, making it smaller. So we have certain tablets, various types, various molecules, which would help in decreasing the size and the volume of the tumor. We have certain devices which you can place inside the uterus, which secrete hormones and prevent the fibroid from growing and taking away the pain, and also decreasing the bleeding that occurs. We call them intrauterine systems. We have radio frequency ablation, which is another method where you can, again, decrease the size of the tumor without actually operating. We have ultrasonography, magnetic resonance focus ultrasonography, which again helps in shrinking these tumors. So there are a lot of non-surgical methods. And there's something called uterine artery embolization, where certain particles are fed into the arteries which feed these tumors, and they block these tumors, and they prevent the blood supply to these tumors. So these tumors, these fibroids, they don't grow. So we have a lot of non-surgical methods before we actually think of doing surgery. And even if we do surgery, we have minimally invasive surgery, such as laparoscopic or hysteroscopic surgery, where we tackle these tumors from above through small holes, or we tackle the submucous fibroids or fibroid polyps from below using a hysteroscope. So by these methods, we can actually prevent a major surgery, meaning removal of the uterus, tubes, and the ovaries, which is commonly done and has been happening in the past, and probably a little less right now because of these new diagnostic and therapeutic methods. So you don't have to chop off the entire uterus, chop off the tubes and ovaries, and create menopause earlier. Because like I said, fibroids are very common, and they can actually happen at a very early age. Maybe in your early 30s, early 20s, you'll see fibroids popping up, especially when you do an ultrasound. So it's very easy to diagnose a fibroid present inside your womb by just doing a simple ultrasound, and you can see the location, size, and therefore you can also plan the sort of treatment that one would want to do depending on those findings. So having said this, I probably want to send out this message that fibroid in the uterus is nothing to be really alarmed about. It's a very common thing that we see in our practice. If you don't treat them and they're not really disturbing you, we do know that once you reach menopause, these fibroids will gradually shrink and disappear, so you can leave a lot of them alone. And the treatment options now are medical and less, invasive, and rarely we go for extensive surgery. So I think hysterectomy will definitely become something that we won't be doing in the future, and probably we'll be able to deal with fibroids in a much, much easier manner than we have been doing in the past.